Non-surgical periodontal treatment, non-invasive methods to address periodontal disease, dental prophylaxis, complete removal of calculus, soft deposits, plaque, and stain from all supragingival and unattached subgingival tooth surfaces, scaling and root planing, gingival curette, cleaning the gingival lining of the pocket, and antimicrobial and antibiotic agents. Surgical periodontal treatment, indicated when non-surgical treatment is ineffective in stopping disease process. Advantages include allow access to the root surface, easier, more thorough scaling and root planning, improves patients' access, and disadvantages the procedures are limited, may not be available for all ages and health status, time, cost, aesthetics, and discomfort. Periodontal surgery, remove excess tissue, gingivectomy, surgical removal of diseased gingival tissue, and gingivoplasty, surgical reshaping and contouring of gingival tissue. Incisional surgery is performed when excisional surgery is not indicated, known as periodontal flap surgery or simply flap surgery. The dentist may perform thorough scaling and root planing of exposed root surfaces, moving the flap laterally to cover root surfaces and adjacent tooth, and recontouring of underlying bone. Osseous bone surgery involves modification of the supporting bone. Osteoplasty is additive bone surgery. Bone is contoured, reshaped, and added. May use bone graft or artificial bone substitute. Osteoectomy is subtractive bone surgery, where bone is removed. Crown lengthening exposes more tooth structure for the placement of a restoration such as a crown. Common for aesthetic anterior restorations. In adding to aesthetics, indications for crown lengthening include a tooth that is fractured close to the gingival margin or alveolar crest and subgingival caries. Soft tissue graft. Pedicle graft used to move gingiva from the adjacent tooth or edonculus area to a recipient site of another tooth. Free gingival soft tissue graft has a donor site that's located away from the grafted site. Connective tissue graft, a small portion of connective tissue removed from palate opening. Periodontal dressings, also known as periopacs, are used to hold the flaps in place, protect the newly forming tissues, minimize postoperative pain, infection, and hemorrhages, protect the surgical site from trauma during eating and drinking, and support mobile teeth during the healing process. Non-eugenal dressing, most widely used type of periodontal dressing, supplied in 2 tubes, easy to mix in place and has a smooth surface for patient comfort, has a rapid setting time if exposed to warm temperatures, and cannot be mixed in advance and stored. Post-op instructions include limit activity, don't rinse for 24 hours. There may be some bleeding for 4 to 5 hours. Some discomfort is expected. Soft diet to start. Leave the dressing in its place. Some swelling is normal. No smoking. Gentle brushing, medicated mouthwash after the first day. Dental perioscopy is a fiber optic camera and magnifies the treatment area. Dental periodontal probe collects measurements automatically. Lasers remove tumor and lesions, vaporize excess tissue, remove and reduce hyperplastic tissue, and control bleeding. Laser safety. Precautions must be taken to protect both the patient and dental staff during laser procedures. Protective devices and measures include shielded eyeglasses, matte finished instruments, protection of non-target tissues, and the high volume evacuation.